Atopy and canine atopic dermatitis, CAD. Atopy is a genetically inherited predisposition to allergic reactions, often involving IgE. And canine atopic dermatitis is a hereditary pruritic inflammatory skin disease triggered by environmental allergens. The predisposed breeds are West Highland Terriers, Labradors, and German Shepherds. For the pathogenesis, it can happen through sensitization, inflammation, activation, and triggers. For sensitization, it's allergens that penetrate the skin. For inflammation, it's infiltration by inflammatory cells. For activation, skin cells produce inflammatory mediators. And the triggers can be fleas, mites, fungi, pollen, mold, and feathers. The clinical signs in dogs is pruritus, erythema, papules, and liquefaction. The secondary lesions is pyoderma and seborrhea. And the forms is dermatitis, which is most common, rhinitis, and conjunctivitis. In cats, they can get generalized pruritus or facial pruritus, military dermatitis, and systemic alopecia, as well as pruritic ears and indolent ulcers. For the diagnosis, you need to exclude other conditions and assess the onset, the seasonality, and the predisposition. Check for pruritus without initial lesions, and then evaluate the glucocorticoid response. Fabry's criteria means they need 5 out of 8 to have canine atopic dermatitis. So an onset before 3 years old, an indoor lifestyle, glucocorticoid response pruritus, pruritus without skin lesions initially, front feet involvement, affected ear pinna, non-affected ear margins, and non-affected dorsolumbar area. For the treatment, manage flares, so address flea hypersensitivity, bacterial or yeast overgrowth, and environmental and food allergens. The sympathetic treatments can be prednisolone, cyclosporin, and oclacitinib, as well as topical shampoos, sprays, spot-ons, creams, and gels. Supportive therapies can be antihistamines and essential fatty acids and vitamins. Allergy vaccines are also available for desensitization. For allergy testing, the purpose is to identify allergens for desensitization, not for canine atopic dermatitis diagnosis. The methods are intradermal skin testing and IgE blood tests.
There we go.